Time now for a look at your health, and as the weather changes from cold to warm and back to cold again and the heat flares up, well, guess what? So do migraines. Dr. Mitchell Goldman is with us from UCSD. Thank you for being here, and you're joining us to talk about migraines and how we can hopefully prevent them. Let's first define the difference between a migraine and a headache. How do you really know when you have one or the other?
Well, a migraine is usually a headache, but it lasts for hours, if not days. It also is so strong it impairs your ability to really function normally. So it's not just like a regular headache.
Let's talk about some of the triggers. We actually have a list for the people out there because this weather that we've been having, the fluctuation back and forth, is one of those?
It is one, and we can see that there's a number of triggers on there, but these aren't the only triggers. There are dozens and dozens of triggers that are out there. So if you don't have one of the triggers that you're seeing on the screen, you still could have another one. It could be hormones, it could be stress. There are stories of people that have gone to work and they're reviewing papers all day and they have headaches all the time and migraines. As soon as they retire from their jobs, headaches and migraines go away. So many different factors can trigger it.
A lot of stimuli. So how do you get rid of them?
You know, it's very difficult, as people, our viewers know that have migraines, very difficult to actually get rid. You know, of course, if it's very severe, pain medications and anti-nausea medications are very important. But the most important thing is to try to prevent them from occurring. And there are a number of medications that are available that your doctor can prescribe to prevent them. The latest medicine is one that'll actually get rid of your wrinkles too.
Yeah, I thought that was interesting. During the commercial break, I was joking, saying Botox can actually get rid of your frown in 2 ways, perhaps.
Yes, it can. And it's very interesting. When we first started doing Botox for wrinkles 10, 15 years ago, we noticed that patients that had Botox treatment, actually their migraines went away. Now on the screen we see that those are the injection sites that we've done in clinical studies to get migraines to go away. Every person does not have to have that many injections. This is how the research was done.
I'm curious though, do migraines mainly, do you feel them in a certain part of your brain? I noticed the injections were in different sites, so are some of them frontal or some of them in the back of the head?
Absolutely. You can get them on one side of the head, on the back. People with migraines sometimes will see that, will tell you that it's exploding or it's contracting. They have very different ways to do it, but the most important thing is sometimes you need a very large amount of something like Botox to make them go away or to make them not come on, and other times just a little bit of Botox is enough to keep them away.
All right, well, before we leave you, a website that you said is a great source for people who might suffer from
these. I tell you, one of the smartest doctors with migraines is Dr. Andrew Blumenfeld, and he actually is right here in San Diego. He conducted a lot of the research with Botox and others, and he has an office called the Headache Center up in Encinitas. And if you go to our website, you'll find information about Dr. Blumenfeld as well as the Headache Center.
Yeah, just go to fox5sandiego.com and we'll have everything there for you. And as always, nice to see you. Thank you for being here.
No more headaches.
No, there you go. Over to you, Lauren.